All right, hello everybody. Thanks for joining. My name is Patrick Horne. I'm a nurse practitioner at the University of Florida, and thank you for joining me. Today we're going to go through some frequently asked questions, FAQs from patients with MASLD and MASH. So these are things that my patients ask me on a pretty regular basis when I see them in clinic for the first time and even in follow-up. And probably I would assume very similar to what maybe your patients ask you as well. But probably the first question I get from my patients is, how did I get fatty liver? How did I get MASLD MASH when I never drank alcohol? And of course, that is important to discuss with them that while alcohol can be a component of this, this is driven more by other metabolic factors, cardiometabolic factors, heart disease, hypertension, hyperlipidemia, diabetes, obesity. Alcohol does not have to be involved to play a role. I also like to emphasize to them that there's a strong genetic component associated with MASLD and MASH. And so as you get into a history, a lot of patients will then realize, oh yeah, my father or my mother or my siblings have diabetes or have been overweight, etc. So that's probably the number one question I get is, how did I get MASLD MASH when I never drank alcohol? And so alcohol doesn't have to be part of this. I think the second most frequent asked question that I get is, what do I do about it? And so that lends itself to the conversation around lifestyle modification, diet, exercise, weight loss, emphasizing per the guidelines, the Mediterranean diet, emphasizing the exercise component. If possible, at least 150 minutes a week of exercise. And then around diets, again, centered around Mediterranean diet. And then the goal of weight loss is ideally somewhere between 7 to 10%. But we know even less weight loss of 3 to 5% has benefit. Probably my third frequently asked questions that I get from patients is also, can I drink alcohol when I have MASLD and MASH? And so I think that's a tricky one. I think it depends on the situation. I think it depends on the patient. I think it depends on where they're at in terms of fibrosis. So I think you have to individualize that one, but certainly regular alcohol use on a daily basis, heavy alcohol use, in my opinion, is not recommended. And those are some of the frequently asked questions that I get from my patients with MASLD and MASH. And I want to thank you for joining today.